I want to show you two clips. Here is Paul Ryan responding to the idea, like, what is healthcare? And in terms of, like, what responsibility does the government have to making sure, to doing everything it can to make sure its citizens are as healthy as they can be?
Let me ask you this philosophically. Is health care a right or a privilege?
Not from the government. So if you say that health care is a government-granted right, then we as citizens are giving the government too much power over our lives. If we are saying we want this to be a government-granted right, then we as citizens are saying it is the government who gets to decide where, how, when, and under what circumstances we get health care. That's given the government far too much power over our lives.
Okay, but let me ask you this question.
No, I want to get you there. Don't cut me off.
All right.
I love you. We're buddies, but, you know, we're
enough.
friends.
Go ahead.
But the point is, healthcare is a need, and we respect that need.
Okay, so it's not a right. It's not a privilege. He won't say privilege. But that's what it is, right? In his mind, it is a privilege. It's a need. We respect that need, but what are you going to do? That's basically what it comes down to. We're aware that it's a need, but that's all they're prepared to do. I want you to contrast that with what Bernie Sanders says. And I don't know if you saw that West Virginia town hall he did the other night with Chris Hayes, but all those folks in West Virginia sure thought it was a right, that they had a right to have good health care. Here's Bernie Sanders.
In my view, Jake, the United States should join every other major country and guarantee health care to all people as a right. Now, it is understandable that if you're young and you're healthy and you don't have a lot of money, you would say, well, you know what, I don't need to buy health insurance. But on the other hand, you can get hit by a bus tomorrow and end up in bankruptcy, having your credit rating destroyed. So I think what most Americans believe, and certainly people all over the world believe, health care is a right. Now, what is disturbing also is that while it is true some may voluntarily drop out, the other truth is that older people, according to the AARP, people who are making about $26,000 a year will be forced to pay $7,000 a year more than they're currently paying for the same health care. In other words, the cost of health insurance for older people is going to rise precipitously. And many of those people are going to drop out, not voluntarily. It's just that they cannot afford the health care they need. Imagine being 60 years of age and not being able to afford the health care that you need. That is part of what the Republican program is. Bottom line is, though, that our goal should be to provide health insurance to all people, not to throw 24 million people off of health insurance, raise rates for older people, defund Planned Parenthood, decimate Medicaid, and take people who today are getting opiate treatments off of the treatment they're currently getting. This is not, Jake, and we should be clear about this, this is not healthcare reform. You don't throw 24 million people off of healthcare and call it reform. This is tax reform, providing $275 billion in tax breaks for the top 2% at a time of massive income and wealth inequality. It is a grotesque and ugly plan. And let me conclude by saying this. If you are old and you have no health insurance, you're 55, 60 years of age, and you have no health insurance and you're sick, you will die. You may die because you can't get to a doctor when you should.
Yeah, I mean, and you have Sanders who's going on the offensive. He's not just going out there and saying we shouldn't cut it. He's saying we should expand it. And that makes it much easier for people to, I think, understand. I mean, it's very straightforward. I mean, you've got Paul Ryan out there saying, well, we respect there's a need. I mean, this is so basic. This is so remedial in terms of politics. One politician says we want to expand the ability for people to be healthy, and the other says, well, we recognize that people get sick.
And then the other ones say, oh no, if Bernie's out there, that'll be so bad in the Rust Belt states for all the people that make 30,000, but are worried about the budget deficit and giving the Koch brothers tax cuts. Do you see?
Why did you use my voice for that?
That's also the Schumer voice.
Oh.
And every time he's out and he's talking and he's mansplaining it, he's very rude and it's totally unfair. And what we need as Democrats is to advocate that we recognize all sorts of good social things, but we don't say anything about healthcare ever.
Hey, everybody. Sam Seder here.
Donald Trump is a bad guy. Believe me. It's true.
It is true. And you can subscribe to this channel by subscribing to this channel. It's true.